ourselves throughout the proceedings. Unless you are speaking, then if you unmute yourself, I will recognize you. So good evening again. I am Dr. Nokuthula from Presbytery Church, representing Ethekwini Presbytery this evening. Welcome to our seminar/webinar/talk on mental health. July is Mental Health Awareness Month. Thank you so much for joining us. To begin our proceedings this evening, I'm going to call on Reverend Mncube-Gasa to please come forward and open this gathering with devotions this evening. Thanks for this.
Thank you, Dr. Nokuthula, for this opportunity. I greet you all, friends, those who are in this venue and those who are watching this webinar online. We welcome you to this space where we are having an awareness on mental health. You are all welcome from wherever you are. It is a great pleasure that you are able to join us in this meeting tonight. Allow me to open this webinar with the word of prayer. But before we pray, I just want to ask all of us to look at God's way. Depression and anxiety are some of the greatest problems in the world today. Everybody gets depressed at times, but some people are depressed nearly all the time. Even people in the Bible weren't depressed. Elijah is an example. Elijah was a tremendous spokesman for God. For 3 years, he had been God's mouthpiece for the nation of Israel. All kinds of miracles had taken place through him, and there was a great spiritual awakening in Israel. But one person that did not like Elijah was Jezebel. She was the queen of Israel, and she was a very wicked woman. Jezebel hated Elijah, partly because he had so much influence over the people, and also because he had challenged 450 prophets of Baal and won. Jezebel's husband, King Ahab, told Jezebel everything that Elijah had done, and this made her extremely angry. Let's pick up the story at that point. We read from the first Kings chapter 9, verse 1 to 4. First Kings chapter 19, not 9. Chapter 19, verse 1 to 4. It reads as follows. Now Ahab told Jezebel all that Elijah had done, and how he had killed all the prophets with the sword. Then Jezebel sent a messenger to Elijah, saying, "So may the gods do to me, and even more, if I do not make your life as the life of one of them by tomorrow about this time." And Elijah was afraid, and arose and ran for his life, and came to Beersheba, which belongs to Judah, and left his servants there. But he himself went a day's journey into the wilderness, and came and sat down under the juniper tree. And he requested for himself that he might die, and said, "It is enough. Now, O Lord, take my life, for I am not better than my fathers." Now, Elijah was a prime candidate for depression. He was physically tired. He was emotionally exhausted. He was disappointed how things had turned out, and now Jezebel threatened his life. He was an emotional wreck with all kinds of emotional problems: fear, resentment, guilt, anger, loneliness, and worry. He was human with all kinds of human emotions, and he became depressed. Elijah was so depressed that he was ready to die. In fact, he asked God to take his life. Why did Elijah get depressed? Because he had faulty thinking. I hope we know that emotions are controlled by our thinking. If we think something is bad, we become sad. If we think something is fun, we become happy. The fact is that our emotions are controlled by our thoughts. The Bible says in Proverbs chapter 23, verse 7-8, "For as a man thinks within himself, so he is." If you think in a negative way, you are going to feel depressed. Our emotions are caused by how we interpret life. That's one of the reasons the Bible says in Philippians chapter 4, verse 8, "Whatever is true, whatever is honorable, whatever is right, whatever is pure, whatever is lovely, whatever is good, if there is anything excellent, and if anything worthy of praise, dwell on these things." Come, let us pray. Almighty God, our Heavenly Father, we bless you. Thank you for the gift of this day. Thank you for the gift of life. We thank you for the fellowship we have with our families, friends. We thank you for making it possible for us to gather in this space. We thank you for each and everyone who has been blessed to be able to connect and join this webinar. We come to you, Father, asking that you give us power not to focus on our feelings, but to focus on facts. Give us courage not to compare ourselves to other people. Give us power to see what is taking a toll on our lives. To know how not to exaggerate the negative. To know how to care for our physical needs. Take, Father, all our problems, all our challenges. We ask that we may encounter the power of your Holy Spirit so that we may be able to be conquerors. Give us a new direction. We ask all this in the wonderful name of our Lord Jesus Christ, now and forever.
Thank you so much for this. And thank you for the inspirational devotions and really reminding us that the people that we admire in the Bible, the great, powerful men of faith, they too, they walked this journey, they too, they went through these challenges of things like depression. Phyllis, you've mentioned a lot, and I'm looking forward to the talk by Dr. Mncube-Gasa. She's going to expand on these things. You mentioned being physically tired, emotionally exhausted, you know, and all these things like fear, resentment, and anger. Thank you so much for this. And ladies and gentlemen, I hope you are all feeling welcome. At the appropriate time, we will open the floor and you'll be able to ask questions, comment, or discuss. But right now, we can move right along, and let me tell you about our guest speaker this evening. Our guest is Dr. Nokuthula Mncube-Gasa. She completed her undergraduate degree, that is NPCHD, a degree in medicine at the Nelson R. Mandela School of Medicine, that is here in the KZN. So she became a medical doctor, qualified in 2005. In 2017, she then obtained a specialist degree in psychiatry. So Dr. Nokuthula Mncube-Gasa is a specialist psychiatrist. She has worked in the northern parts of KZN. She has served our communities at Wilenzana Hospital that is draining the entire northern region of KZN. She then started her private practice in 2018, and she is currently now exclusively in private practice ever since 2018. She's practicing in the northern parts of Durban, Orana, north of Durban, as well as Umhlanga region. So you will find her at Akeso Clinic in Umhlanga, at Nurture. She is also at Ruby Med in Barito. She has lots of experience working with both the young and the old, and she's treated all sorts of psychiatric conditions. She does have a special interest in child and adolescent psychiatry, and as well as, you know, sharing information and educating on mental health awareness. So we're very honored to have you this evening, Dr. Mncube-Gasa. Welcome to the Presbyterian Church in Ethekwini. Thank you for coming to us to educate us. Ladies and gentlemen, let us welcome Dr. Mncube-Gasa. Over to you, Dr.
Good evening to people here with us and all those that are around who have connected to be with us. Thank you to Dr. Unomsi and for bringing this opportunity to me. As Mncube-Gasa has said, when it comes to depression, not only depression, but also with anxiety, it all starts with the mind, because the mind influences our emotions, and in turn, our emotions influence our actions and behaviors, so it becomes a whole triad. And I was quite impressed to find out that, okay, spiritually, we talk about that in our corner, but also within psychiatry and psychology, we are taught that in terms of understanding the human mind, it's mind, body, and soul, it's interconnected. You cannot focus on one and leave the other two. So in order to fully understand a human being and then fully to understand and treat someone and help them, you have to understand that a person, man, is made of all these three entities. So as I stand here today on this month of mental health awareness, I too, and everyone, am conquering my own anxieties, as social public speaking is not my forte. So I am taking my thoughts, I'm taking my emotions aside, and I am conquering. So thank you. We are going to talk about anxiety, depression, as well as suicide. Just as to highlight and to make people aware just how prevalent these conditions are, how debilitating they are to our society, young and old, and also to bring hope to everyone in knowing that there is treatment and one doesn't have to suffer alone. So in my talk today, I'm just going to highlight in terms of what they are, in terms of how one fits in. If one may be suffering with anxiety or depression or having suicidal thoughts, or if you know of someone through this talk, you might be able to identify someone and maybe that glimmer of hope for them to help them through this process. Just a table of contents in terms of introduction from the World Health Organization. We talk briefly on anxiety, what anxiety is, the normal non-pathological anxiety disorders, just to highlight what they are, depression, suicide, and how and where one can get help in terms of treatment as well. For the year 2022, the World Health Organization's campaign is making mental health and well-being a priority for all. So the World Health Organization has reiterated the message and has been spearheading campaigns in terms of mental health awareness, making mental health a priority, and they came up with as captioned with the title of the slogan, there is no health without mental health. As most people tend to focus only on the physical aspects of health. Just a few statistics for all of us to know, as in 1 in 8 people globally are living with some form of mental condition. And this was a study that was done in 2019 research. So fast forward to 2022, I'm sure this number has increased greatly. As we've seen with the pandemic, it has not only created a surge in anxiety and depression, but also in other forms of mental health illnesses, and also decreased the number of facilities where one can get help. So, secondly, people with mental health conditions, they experience severe human rights violation, discrimination, and stigma. And I believe that this is due to the fact that we do not have much education on mental health. Therefore, the only form of mental health that we know from personal experience growing up, and I will say it in this, I hope no one minds. whenever you thought of someone with mental health, there's an image that comes to each and every one of our minds of what we call, which is also a derogatory term, that Umhlanga. Umhlanga is a person that we see on the street who is unkempt, who is talking to themselves, who is pacing up and down, wondering either eating in the rubbish bins or is being ridiculed within the communities, and everyone is afraid of that person. So that is what each and every person associates mental health with, not knowing that there are different kinds of conditions within mental health, and that picture, which we all have, is that it's a picture of a severe form of mental illness, which only developed after a couple of years, and also due to either lack of support and especially treatment for that individual, unfortunately ending up in those dire situations. And then depression is one of the leading causes of disability globally. Around 2019, it was rated at number 3, but I would like to believe it's probably 2 or even number 1 as a disease of burden globally due to everything that we have suffered during this pandemic. With depression, we find that 20.3% of university students, this is within South Africa, experience some form of mental disorder, some form of mental illness. So within this congregation and all others, you can imagine how many young people are in university, first year, whichever year. Some of them are suffering from anxiety, some are depressed, some have, due to all these other stresses that led to substance use, having substance-related conditions. Others have cognitive or even worse, schizophrenia and the likes. And going to suicide, suicide being the 3rd leading cause of death in the youth globally. And the youth is not only maybe people who are what we refer to as young adults within the early 20s, but from the ages of 10 years to 24. It is the 3rd most leading cause of death. We are parents, we are aunts and uncles and grandparents, so you can just imagine with our young ones, from primary to tertiary or even within working institutions. Within the pandemic, in the first year, World Health Organization noted a global rise in anxiety and depression by 25%. That was 2020. We're in 2022. As much as we're not living so much of that stage of fear and anxiety with COVID itself, but we're now suffering from the consequences and the impact. So in 2020, the rise was 25%. I'm not sure what happened to 2021 and so forth. So we can just leave it up to our imaginations. But what I also like to highlight, and also from the World Health Organization, is that all mental health conditions are treatable. And some of them, most of them, are even curable. So we cannot live in the fear. We must know that there is hope for each and every condition. One can still be able to maintain a healthy life and be able to be productive within their lives. Unfortunately, as much as all conditions are treatable, we still have that low effective treatment coverage areas in globally, not just for South Africa, even within the first world countries. So for us, third world countries, we're also suffering a great deal. Anxiety. Now, a lot of people speak of anxiety and think of it as being pathological, but we also need to remember that anxiety is normal because it is a normal reaction to stress or any difficult time one might be experiencing. It is a response to any threat that is known or unknown, or even when one is having an internal conflict, be it emotional or psychological effects. And how one presents with anxiety is usually having fear, intense fear, or feelings of worriness. and having a feeling of apprehension or even becoming restless. Anxiety does help us, it's good, because it is actually the drive for one to succeed. Think of yourself when you were a student, or if you're students here. If you know that you have a test 3 months from now, you're relaxed. But as the days get closer and closer, then the feeling kicks in, the anxiety kicks in, which then, you know, it triggers often a certain cascade of biological reactions within one's body, releasing a hormone which is also good for us because it is our flight or fright hormone, which is cortisol and adrenaline, and it gets us going. It gets you to hit your books, it gets you to do that project or work, it gets you on time if you have an appointment, so you don't want to be late. So anxiety is good for us because it helps us and it propels us into greater heights. And it also keeps us vigilant in terms of, you know, being aware of your surroundings, watching out for any imminent dangers. However, sometimes the anxiety then can become so intense and so uncontrollable that one starts having what we call panic or anxiety attacks. And how one would present with such on the picture on the right, as much as it's for common symptoms of social anxiety, it's actually for most anxiety symptoms. When one presents, if we're to start from head to toe, head, knees, shoulders, that song that kids sing in nursery rhyme, from your head, one would have feelings of disorientation. You might even have a feeling of fainting, numbness and tingling from the face to your arms to your lower limbs. Other people may even think they're having a heart attack or a stroke. Face, one experiences flushing of the face, having a dry mouth, having this ringing sound in your ears, and also just feeling a bit dizzy. What happens to your chest? That lump in your throat, that choking feeling, chest pains, shortness of breath, difficulties in breathing, and your heart feeling like it's doing a marathon, it's just galloping or palpitations. For some people, they may even experience abdominal problems in terms of having bloating, diarrhea, or for some people, even going to the toilet due to the running stomach. For women, they may even experience symptoms that are related to their reproductive organs during that period of time. Some people have tremors and they're sweating. So all these symptoms can occur, or some of them may occur when one is having a panic or an anxiety attack. As much as it feels like when you're having a panic attack, you are going to die, you are going to pass out and never come back again. Always remember, an anxiety or panic attack, it has a start, it has a peak, and it has an end. It always ends, it will never ends. And it usually lasts for about 4 to 6 minutes. Now, due to stress, one can have so many repeated events happening in their life that are stressful. And if they're happening, maybe isolated events, you have the stress, you have the anxiety, you have the emotional reactions, and then they go away. However, if one encounters repeated stress over a long period of time, stress then turns into anxiety. And then that kind of anxiety tends to be a disorder or pathological. And one of the things I wanted to highlight with this slide was that of trauma. Because when we go through stress, we might be experiencing certain stresses which might be emotional or psychological, which is basically they overwhelm us to the point of not having the ability to cope. How God has created us wonderfully is that He's created a certain system. It's a nervous system, central nervous system. It has a part to make us run away from death and run away from fear, not actually death. Fear or anything that might be dangerous, and it has an ability to also calm us down. So in a stage of any event that might be disturbing, dysfunctional to a person, it gets to a point where the part of our brain that is supposed to help us calm down, it cannot cope anymore. And then it brings us to the stage of disarray, distress, and leading to anxiety. Now, when we have anxiety disorders, for any condition to be called a disorder is when it now starts interfering with my life, starts interfering with my personal life, my social life, my occupational, spiritual, and otherwise. If I'm having panic attacks once in a while because there's a certain event which has triggered that feeling, that's okay. But when I start having panic attacks or anxiety attacks and there is nothing that I can pinpoint it to, and it is so debilitating, and I feel like I'm not able to control it, then it's becoming pathological. It's now a disorder because it's interfering with my life. For many people, for all of us actually, anxiety disorders can affect any race, doesn't choose class, doesn't choose gender, and especially age. We see as young as kids within their, I think my youngest client who has anxiety is a 10-year-old who's coming for treatment. And in training, we see even in younger kids, even before going to school, because of anxiety. So really from the youngest to the eldest of the people. But what's more important, and what is, I always say, funny to me when it comes to the studies, is that we always find that more women versus men suffer from this condition. I'm not sure whether it's a true reflection or it's because we as women have help-seeking behaviors. When something is not right, something is off, we go for help, while men tend to withdraw and isolate. So we never have a true reflection of what happens. Causes for these conditions, anxiety disorders, they're multiple, could be anything for anyone, especially external causes. Stress is subjective. What might be stressful to me might not be stressful to and may not be stressful to the next person. But whatever an individual is dealing with in their life that they have deemed as stressful and they are unable to cope with, it might lead them to having an anxiety disorder. In this world of COVID, the pandemic has been one of our stresses for all of us. Death, losing loved ones, it could be a potential cause for anxiety. Childbirth for us women could be a cause for anxiety. Being a first-time mom, you're going through all these changes, biological, you're not in control of, but also there's this intense fear, am I doing it right, am I doing it correctly? And you're hearing all these advices from left, right, and center, you do not know what's right and what's wrong. Work-related stresses. You have a boss who is sitting on your neck, micromanaging you. You have colleagues who you do not get along with. They're making the work environment unpleasant for you. Academics. This speaks to young people. Stress from home. Stress to perform. Stress to be like uncle. So Auntie is a doctor, therefore you will be a doctor too. Child is getting 70 instead of getting praises and positive, affirmations and positive reinforcement. But what happens to the other 30%? You're crushing children's souls. Anxiety because of tests, because of exams from peers, and as well as other forms of traumas and external stresses. Internally, we must also remember mental health is related to other conditions, medical conditions, such as asthma could be one of the risk factors for anxiety, such as diabetes, and for some people, even medication that they're taking, medication, steroids is one of the factors. Drinking coffee, caffeine gives you energy, but then it also can drive you to a point of having anxiety problems. So we must look out for those. Coming from a family which has a positive history of anxiety, I may be then about 25% chances higher than an average person of developing anxiety in my lifetime. For some people, there are no causes. It just starts with you. In medical terms, we call it de novo, it's just it's you. So from your family, from you going on onwards, it might be the start of things. There's just no causes. And as I said, it's that intense, disproportionate fear that one feels, and it lasts for longer periods of time, more days, more weeks, or even months for some people. And one feels like they are unable to cope, they're not in control of it, and that feeling of need. There are different types of anxiety disorders. So not all of us are going to present the same way. The symptoms are similar, but also in terms of diagnosis, with whichever disorder one may have. I may have what they call a panic disorder. When I have a panic disorder, it simply says I've had a panic attack, and I've had them so frequently that now I start being afraid of having more panic attacks, to the point that it impairs my functioning. I would rather stay at home because I'm afraid to go out to places where if I were to have another panic attack, I may not be able to find help. So that's what we call a panic disorder. And it starts impairing on that person's functioning. I may have what they call obsessive compulsive disorder. It's another form of anxiety. It has two components. It has obsessions, which are thoughts, which are intrusive, which are repetitive. Could be a thought of anything, but they usually have a theme. Most people have to do with cleanliness and order. So I have these thoughts that are coming into my mind, or even safety, thought that, oh no, the burglar is going to come in the house, so I must go and check. So every time that thought comes into my mind, I go to the doors and the windows to check if they're all locked. So then it becomes a compulsion. I do this so often to the point that I will check my doors or my windows 10 times at a time. And I feel that if I have not checked my doors 5 times in a row or 10 times in a row, then definitely somebody's going to come in. The person who has this form of anxiety, they know that what they're feeling is not realistic, but they also feel so powerless as to how to control it. So they feel compelled to keep on doing whatever ritual that compulsion is in order to help them to cope with this thought that keeps on coming into their mind. And then we have trauma-related anxieties. They are divided into, it's only just a time or duration factor. I have been through a traumatic experience, being female, being South African. I may have gone through a traumatic experience of sexual assault. And after that trauma, there has to be a presence of a trauma that is significant to the person's life record. I then start having the symptoms whereby I am fearful, I am restless, but I also have what we call re-experiencing. I have memories, be it in dreams, nightmares, be it in flashbacks that keep on coming, that keep on playing about the traumatic event that I have gone through. And in order to try and cope, I then try to avoid and pull myself either from people or anything that reminds me or that trigger that memory of my event in my head. And also with that, I start being easily startled. My mood is not settled. I'm irritable. I have disturbances in sleep. Those are trauma-related anxieties. And from acute to post, when it's acute, I will just have those symptoms for a period which is less than a month. But when it's post-traumatic, those symptoms have been with me for more than a month and they're continuous. And that's how we differentiate between the two. In specific phobias, most people know this one because specific phobias could be those with fear of height, fear of darkness, fear of being in closed spaces. So this is just specific to whatever phobia, intense fear one has of a certain thing. And then we treat that specific thing that triggers the phobia. Social phobias, social anxiety is what we have. So nobody has essentially having anxiety when you have to be subjected either for some people being in a crowded room with people that they are unknown to you, or public speaking, having to stand in front of people and speak. And the fear generally comes from fear of judgment, that you're going to mess up. and somebody's going to laugh at you or they're going to ridicule you or something. But then that fear becomes so intense that it cripples people from actually venturing out and doing things. We will talk about the management of both anxiety and depression later, as it essentially is the same. I always say anxiety and depression are like two identical twins. You cannot have one without the other. Even when you have just anxiety disorders, you would have some mood symptoms. As for depression as well, you may be diagnosed with depression, which is a mood condition, but you would have some of the anxiety symptoms. And the way that God made it, and with the help of the researchers and the scientists, even with management, we use the same type of treatment to manage both the anxiety and the depression. I wanted to first highlight facts versus myths when it comes to depression, because a lot of people out there suffer with depression and they never get the help because of what we tell ourselves and what society tells us. The first myth is that depression is not an illness. It's just a state of mind. You just have to change the way you think and then things will be okay. Watch a movie, listen to your favorite song, dance around, you're in control. But that is not entirely true. Or that depression is a sign of weakness. I've heard this a lot with the clients that I treat. Either from their families, loved ones, colleagues, or even from themselves. They say, I'm weak, which is not entirely true. Or for some, you are lacking faith. You need to pray more. You need to give more offering. You are not strong in your faith anymore. That's why you are like this, which is not entirely true. And thank you, Mncube-Gasa, for highlighting and teaching us that. And I hope a lot of people from this and learning that it is not due to a lack of faith. Or the stigma, as I've said, when you talk about depression or any other mental health condition, we think of Uhlanga. Stigma from society, or stigma from yourself, like, I'm unworthy, I'm weak, and all these negative things that bring us down even further, which is not true. Fact is, depression is an illness, it's a medical illness, it's a medical condition, and it is a silent killer. And I'm sure that we've seen, even in the past couple of weeks, we've had so many young South African entertainers who have resorted to taking their lives. And some of them are known to have been suffering from depression and anxiety. It cripples us to the point that we are afraid to speak, to the point that we do not look for help, we don't reach out. So we need to speak about it. We need to be open and not be ashamed. And people need to be more open, understanding, and supportive of those suffering from anxiety or depression. It also affects all classes, races, and genders. I was telling Pastor Cecil here that my youngest client with depression is an 8-year-old boy, just a baby. He's 8 years and is being treated for depression. And with all other data, we find that more women than men have depression or present with depression. And in South Africa, currently, a lifetime preference for every South African is that of 20% of us would suffer some form of depression. And in terms of its severity, it differs from a mild, moderate to severe depression. Whilst 12% of our South African university students, of that percentage, I think it was 20, they have depression, moderate and severe depression. So those young people currently who will be going back to school or who are already in school, some of them are silently suffering from depression. What depression is, I like the quote which said, depression is a whole body illness which involves your body, your mind, and your soul. How it affects the body part is where it speaks to the physical aspects of one's body, where one presents with constant aches and pains, constant going to the doctor, the GP, and got headaches that are not responding to treatment. I've got back aches, I've got shoulder pains, my lower back is aching, but nothing seems to improve this person's pains and aches. The mind, it affects our thoughts. One has a negative view of themselves, they have a negative view of the future, and they have a negative view of the world at large. And the mind, or part of the mind as well, is the mood, where one presents with a predominantly low mood, although if you are male, you may not also present with a low mood, but more irritability, anger outbursts, and hostility. And the soul, one's belief system is affected because one tends to withdraw from God, thinking that they are unworthy, God does not love them, they haven't been a humble, a faithful servant, and therefore they start losing hope in what has been their anchor, what has rooted them for such a long time. Depression affects how one eats, how one feels, how one sleeps, and how they feel about themselves, how they think about themselves and about everything else, the future, the world at large. How do you identify depression? If I were depressed, or if someone close to you is depressed, remembering that this is essentially the clinical symptoms. Not everyone presents the same way when one has depression. But what one would normally say or normally feel would be an intense and pervasive feeling of load, intense pervasive feelings of sadness. I just say I feel empty, I feel numb. For younger people, it's more irritability. For males, it's anger, which we cannot pinpoint it to, but also with men, there's always something to project that anger to. So I'm angry because you didn't do this, and that's how we make it. Others may feel restless, a feeling of hopelessness, helplessness, and worthlessness. What's the point of even trying? I'm not going to get it anyway, or I'm not going to live around anywhere. We're talking about 40 years. I don't see myself getting to 40 years. Or, there's a post. Rose is also applying. No, I might as well not do it. Why? No, they're not going to. They're going to pick up because of this. Why won't they pick you? No, I'm not good enough. That constant feeling of not being good enough, that constant feeling of not being deserving, that constant feeling of you being a burden to your family, to your loved ones, that continues, and that's where the guilt comes from. There's loss. One might have loss of interest. Previously, this person used to be in a choir, used to love singing, they used to love interacting. Now they've lost interest. They'll make excuses or just pull out giving excuses. They lose pleasure in previously pleasurable activities. Going to movies. Now we are at, I forgot stages of this pandemic, but I think we are now near normal. So it's time for you to go out and be social, go watch movies, go to the beach if they are open, there's no toxins, but one will just enjoy it. Loss of drive, loss of motivation, and losing purpose. I don't see purpose, therefore I do not try. Loss of energy, most of the time feeling low, feeling sluggish, feeling fatigued, or also loss of social interactions and social relationships because you are pulling away from everyone, closing yourself out from everyone. People start distancing themselves. We have that culture. If someone pulls away, we say, oh no, we live in this space. But then we also forget to check just how much time has this person taken away from everyone. No one goes back and says, are you okay? So we just take it to the norm and we push further and further away while the person who's depressed falls deeper and deeper into this deep dark hole that they find themselves in. Individuals have thoughts of death and dying. Death and dying would be me thinking about my great mother and saying, oh, I wish I was with her because, you know, she is in such a better space, in a better place. She doesn't have to suffer any of these injustices, any of whatever might be of the burden to me. Whenever one thinks of a loved one, a friend who's passed on, and they think that person is in a better space than they're living now, that is not a good sign. Not at all. We have thoughts of suicide, which is now us thinking of taking our own lives. Can come as a thought, but the thought becomes so intense that we start planning our suicides. And we become intentional in our planning to the point that we attempt suicide, attempt taking our lives. And for some, unfortunately, it's difficulties in concentration. I can't remember. You tell me something now, I'll stand up to go get it, and by the time I get there, I forgot. Memory is a problem, forgetfulness. And also decision making. Not that I can't, but then I have this feeling that I do not know how, I don't know what is right and wrong. Therefore, I rely on other people to make decisions for me about anything and everything. And also disturbances or difficulties in our sleep. Our sleeping patterns are disturbed. Others may sleep more. Even after they've slept for 10 hours, they'll wake up feeling tired. It's not good. Or for some, they have what we call insomnia, where they have lack of sleep. And insomnia can either be difficulties in falling off to sleep, or you are able to sleep, but then you wake up and you are unable to fall back to sleep. The next day you cannot function because you're so tired, you cannot focus. Our appetite is disturbed as well. For some people, they this, and for some they more. Even with those changes in the appetite, they might have physical signs as well, whereby one keeps on gaining weight. And for some people, especially for us female, then people say like, I go. And you know you won't eat it. You know you have nothing good happening in your life, as it is believed. Or when a person gains weight, it's because they're happy and all is going well. But for some people, they may just be gaining excess amount of weight because they're going through depression, because it affects how our body functions and affects those hormones that are responsible for us gaining and losing weight. So for some it's more, for some it's less. And as I said before, we suffer from those aches and pains, constant headaches, tension-type headaches, migraine headaches, neck pains, back pain, shoulder pains. You're taking all kinds of pills, you're doing the massages, you're going to physio, but it just doesn't seem to get rid. And frequent minor illnesses, frequent respiratory tract infections, you're having frequent flus, frequent stomach ailments. And for some people, having ulcers or what they call gastritis. If you are a person who's been diagnosed with ulcers, they become more frequent and intense. For those with low ulcer disease, then you have what we call gastritis because you are in that state of panic and apprehension. That also affects your endocrine system, or the hormones that basically keep us in balance, and then also control our gastric juices in the stomach. For some cases, or for some people, when I have severe depression, it may even alter my reality state. whereby I now start having what we call hallucinations, where I could either be sitting, there's no one with me, I hear sounds, I hear a person shouting, calling my name, I hear people talking about me, and the message is never good, it's always negative things. And for some, it even goes to delusions, which are fixed false beliefs that one goes through, one experiences, where I now believe that no one wants to hurt me or harm me, or where people were plotting against me. So the things may be different, but they're all related to that depressive dysfunction that one is experiencing. As with any condition, it can also occur due to different factors. Externally, if we have experienced loss, grief does appear similar to depression, but there is then a cutoff where this grief is so pervasive and so debilitating that you now can see that this is not normal. We have ordered on to something more bigger and more sinister. Loss in income, unemployment, that's what COVID was for most of us. Many homes are left without incomes. A breakup in a relationship, divorce, separation, or even for young people, just dating. For some people, that could be due to depressive things. Problems with your finances or going through any legal problems would be another cause. Loneliness. For those who have lost majority of their family members or loved ones, there are lonely. Let's remember them, because some of them, due to the loneliness, they might or they are at the high risk of having depression. Retirement. We all aspire to living above the age of 60 because we would have felt like, yes, we've lived, we've served. But for some individuals in retirement, it's a huge change in a person's life. Being alone, isolated, you woke up for 14 minutes and now all of a sudden all of that is gone. There's no social interaction, there's no support. It could actually lead to depression. Any form of trauma, be it physical, emotional, or even financial, as some people do go through financial traumas or financial abuse within their relationships, family, and all kinds of abuse. Internal causes. Genetics always play a role. My mother is depressed. My chances of being depressed are 4 times higher than an average person. My mother and father are depressed, then double that. Medical conditions. We do know that diabetes is the #1 medical condition that predisposes to depression, followed by strokes. Individuals who had strokes, they usually present with depression after the stroke, as a stroke is also life-changing. Now, when one tries to now adjust to this new normal within the condition, they may find it quite difficult. Certain medications as well could lead to one having depression. Substances, alcohol, and all other illicit substances are major causes of one having depression. So now we go to suicide. Depression and suicide kind of go hand in hand. Although suicide, as the definition, is an act of taking one's own life voluntarily and intentionally. Suicide on its own is not a mental illness, but it comes as a consequence or a potential consequence of certain mental conditions, where depression is the first one, could be anxiety, bipolar, schizophrenia, individuals with dementia, especially in the milder forms of dementia, if they're still not aware of the changes in their life deteriorates. Those people are at high risk. It also affects all ages, from the young to the old. What is of more concern to me, and I hope it is to you too, is that it is the third most common cause of death in the youth, as I've said, between the ages of 10 to 24. Although it rarely occurs in young children below the ages of 10, it usually starts from puberty going upwards. And we find that the rates around the world, they vary in terms of age and the difference between males and females. But what we have seen over the years is a surge increase between the people, young people of the ages of 5 and 14. So if you have kids, if you have nieces and nephews, let's check on them. Current statistics tell us that in terms of the ratios male to female between the ages of 5 and 14, these are the youth who have attempted suicide. We find that there is more males than females in the ages of 5 and 14 attempting suicide, whilst between the ages of 10 and 14, we find that the ratio seems to be similar to female. And it starts to increase again, 1 to 6, more males, 6 males versus 1 female child who attempts suicide. And it goes back to our societies, it goes back to our teachings. Boys don't cry. Something happens, stand up, man up, you are okay. We are not open, we're not emotionally available, we're not emotionally supported to our young men. Hence, they go through a lot of things which they keep within themselves, and we only see it through actions. For those that actually do commit suicide, the numbers are still high within males, around the ages of 15 and 19. For every 1 female who commits suicide, there are about 3 to 5 young males who actually commit and succeed in suicide. Females are 3 times higher at attempting. It's more attention, we call it attention seeking, but it's also help seeking behaviors, while males are 5 times higher at completing suicide. What would be a risk factor for one who is either having suicidal thoughts or previous attempts? Anybody with significant life stresses are subjective. It's a family life, it's school, it's work, it's relationship. Whatever that is stressing that person to the point of feeling hopeless and being in a state of despair and an inability to cope, then that is a risk factor for them. Any mental health condition, especially that of depression, it has been found that 50% of those that died from suicide actually had some form of mental health condition. Chronic and medical illnesses. I've been diagnosed with cancer, been diagnosed with HIV, or I've got disability, physical disability, mental disability, intellectual impairment, or learning disability. Because of my learning disabilities, my peers, they laugh at me, they make fun of me, and I lose self-esteem, and I don't think of any way out of it. I need to remove myself from society. Substance abuse. We have an altered state of mind, and we do not think rationally, and we take impulsive decisions, putting our lives and even potentially of some other people like this. I've had a client who was suicidal, but his way of trying to take his life was to just drive onto oncoming traffic. So not only does it take his life, but potentially others. Yes. Family history of suicidal behavior. For those people who come from those families, their chances of risk are higher should they find themselves facing any significant life stresses and they are unable to cope. For a person who's had previous attempts, their chances for subsequent attempts are threefold higher for females and 30-fold higher in males. In the 21st century world of internet, there is a vast information in terms of methods of taking one's life, legal methods. My young clients will show me their phones, they've got groups on Facebook, there are groups on Instagram, you name it, where they teach you how to self-motivate, how to use what and what to take your life. These are the things which we're not aware of that our kids are exposed to. Living in a family where there is constant exposure to violence or one having a history of abuse, be it physical, sexual, or even neglect, increases one's chances or risks for suicide attempts. How do we then manage, how do we treat an individual who presents either with anxiety or with depression? We have a treatment model, psychosocial and spiritual model, because all these four domains are important in holistically treating or holistically helping an individual through any of the mental health conditions. But specifically, we're focusing on the two, anxiety and depression, and as well as with suicide. Biologically, that speaks to us, the psychiatrists, by the use of medication. There are medications which we use to treat both anxiety and depression. And those medications are called antidepressants. It's pills that an individual is prescribed and maintained. It's usually for a duration of about 6 to 9 months. So no, they are not addictive. If you're on an antidepressant, you will not be on it for life. You can still live a normal and healthy, productive life whilst on treatment and even after treatment. But it is important, should one have depression, a more moderate or severe form of depression, it is highly advisable that one is treated with an antidepressant, as well as any of the anxiety disorders. Antidepressants are the treatment of choice. And when we treat anxiety disorders, because they are a bit more stubborn and we have triggers wherever we turn, if you're out in the environment walking, something may potentially trigger your anxiety or panic. To treat an individual for anxiety, we tend to treat for a long period of time. Okay. Which is then about a year to 2 years. 6 to 9 months for depression and 1 to 2 years for an anxiety. There is a beginning and there is a stop. It's not for life. When we start with the medication for anxiety or depression, because our medication takes a bit more time to start being effective, about 2 to 4 weeks for any individuals to have a response. I always say, think of it as taking a Smarties for the first 2 to 4 weeks. Don't even think if this pill is working or not. Just pop it, it's your Smarties. You're going to have the results in 4 weeks, I promise. Because we have to tell our clients this, because we want an immediate response. I've been living with this pain, I've been living with so many challenges that I need something now instead of classification, but it takes time. And whilst the medication is working in the system, we use what we call medication, which are anxiolytics. Now, these ones are shorter acting, and we use them for a shorter period of time, not more than 4 weeks, to help contain your anxieties that come with the anxiety disorder or the anxieties that come with depression. Psychologically, we use the help of psychologists in what we call psychotherapy. Psychotherapy is talk therapy. There are different kinds of psychotherapies that psychologists use. But the gist of what psychotherapy does is it helps us to navigate through life's challenges. It helps deal with what Mncube-Gasa was talking about. It's called, in psychology, it's called the culture of tribe. The mind, your emotions, and your behavior and your actions. So in treating or dealing with the mind, how one views things, trying to change that, we then help them in terms of changing how they feel about situations. Having, I always say, it's advantage for them to use it from this direction, get someone else to help you see from a different vantage point, and you have different results. It will make you feel differently, and then you will take different actions to those challenges. And they also help us in terms of acquiring coping skills with any other challenges of life, not only those that have brought us to their offices due to anxiety or depression. Socially, because we are human beings, we are interconnected. Sometimes my issues may be due to family, may be due to work, so in getting a social work involved, those people help us with those aspects of social interventions. Within a home situation, within a work situation, if it's a legal situation, they are quite helpful. Spiritually, we can it's important for us to as clinicians to help our clients in embracing their spirituality. We all believe in something, and it's important to have that belief because it helps center us. Even in times where the doctor may feel like it's failing, the therapist and everyone else, but you go to your corner, you go to your corner wherever, and you speak to your maker, and that's where you find strength. So it's important to also enhance one's spirituality. But there are other things which we can do for ourselves. We, not just an individual who is struggling with depression or having challenges of anxiety, but all of us as human beings, we need to be more aware, self-awareness. Knowing yourself, knowing the things that make you happy, but also knowing the things that do not make you happy, that are straining your life. Learning ways of coping with those strains, be it from yourself, in self-help books, speaking to other people for advice, and then making time to do the things that help replenish us, that bring us joy. Many of us do not make time for ourselves. I can make time for everyone else, but then put yourself first. If you have planned that this weekend, oh, I'm going to take a walk by the beach, and then someone calls, I'm going to sleep, and my cat has just died, and I'm feeling so sad. And then what does Mncube-Gasa do? They put themselves aside, and they go crazy with me and my cat. Sometimes, not sometimes, always, it's important to remember ourselves because we are the tool that guides us and that helps us in achieving and helping those that need help too. So let's not forget to take care of ourselves. Doing simple things, they're not simple because they are very effective. Healthy eating, we always hear about it. It has beneficial properties to it. Exercising. I am not a gym person, but I try to 3 times a week because it's a form of exercise. It helps my body, it helps my mind. My mind has its own natural antidepressants. So when we do those things, we're actually helping our body and mind to make more of its feel-good, happy hormones, the things that we may be using from medication and such. Sleeping. There is no better drug than a drug called sleep. When you've had sufficient sleep, you wake up feeling refreshed, you wake up feeling new, your mind is clear, your mood is light. You need meditation. People meditate in the morning, in the evening, because that is your time to actually center yourself. That is your time for you, and also that is your time to get in touch with your spiritual being. You can start today with meditation. It helps. For the younger people, even older, singing, dancing, it's freedom. It's therapeutic. Writing could be in a journal if you are an artistic person. Writing poetry, lyrics, but stories as well. It's a form of you expressing whatever it is that you feel on the inside. It becomes cathartic when you do not keep all those emotions, all those feelings that go swirling back inside. You let them out and you actually see that I'm still alive. They have not killed me. No one has judged me for it. And for the younger generation, some blog, some have blogs. I've got clients who started their Instagram and YouTube channels where they become advocates for mental health within the youth or even older. So do whatever it is that will bring you joy and that will help you reach your inner peace. How and where to get help? It starts by identification. I'm hoping that somewhere, somehow, this talk has helped someone to identify certain things about themselves or about somebody that they know. In identification, then you can start reaching out for support to those that you trust or even a stranger. People always say it's easier to speak to a stranger because they don't know you and they won't judge you. So if it's a stranger, and a stranger it is. Reaching out, and if you are the one person that someone is reaching out to, because people with anxiety and especially with depression, they are so aware of judgment. They are afraid to speak out and reach out. So if someone comes up to us and they want to speak, we must listen. Listen with intent. Listen with understanding. And whatever it is that one comes to you and tells you for as advice or support, we help validate them. Because some of the challenges come in when we invalidate people. When someone says, but I still will need to drive. And I say, but you have a car, you live in Uhlanga, and all those things. Yes, they do know these things, but what they're talking about right at the moment is how they feel inside. They don't need us to tell them that. They need us to sometimes just say, I know what you feel. It makes you feel this and this and this. You have no purpose, you have no way, but you matter to me. You matter to your mother, you matter to your husband, you matter to your sister. There are people like that. So such words, they help us. Showing care and concern for those people or individuals going through any challenges. And we do have a society, an organization, SADC, South African Anxiety and Depression and Anxiety Association. They are quite good, they are helpful any time of day. Their numbers are toll-free. If one is struggling with just having confusion in terms of how they're feeling, or going through depression, they've had a loss, and they just want somebody to talk to, they are always there. When they have numbers, we have numbers there. Suicide line, we have 0800 567 567. And for any other thing, even with suicide as well, or any other condition during the day, they are 0800 21 22 23. And nighttime, 0800 12 13 14. If you don't want to call, they can call you. You send them an SMS. They are people who are doing these SMSs. It's 31393, and they are truly enlightening. Other places of where one can go: government institutions. We have clinics. Within most clinics, there are nurses who are psych trained, so who do offer counseling, who do offer therapy. And if they see that your condition may need maybe a specialist, then they will refer one to a nearest hospital. Within the hospitals, we do have psychology departments where we have psychologists who actually help us to offer psychotherapy, social workers, social services, and doctors involved, psychiatrists. There are clinics within hospitals, mental health dedicated clinics for anyone using those avenues. And for those that want to use private avenues, church is always the first way to go. Speak to your pastor, speak to your spiritual advisors, speak to whoever that you are closest to or that you feel that you can trust. They will also support them, listen, they will also support, and they will assist in any way possible. And I've had a lot of other clients that have been referred via that route, where they have been offered counseling, but they feel that they may benefit from education and such. So we go that route. Going to a private hospital as well, or seeking the help of a social worker. They are in private as well, private psychologist and psychiatrist. Help is ongoing, help is available anytime. Person just needs to reach out, and even if they don't reach out, just say, I'm tired. Whenever someone tells you they're tired, inquire, have more questions in terms of how was your day? How have you been feeling? Not just, oh, you'll be okay, or you go sleep, or you need something. But just try to go deeper. It may feel a bit intrusive, and some people may withdraw, but they have time to actually think about the things that you've asked with care and they reflect on it, and they may come back to you some other time and say, you know, when you asked me this was what I was actually feeling. And I will aim from there.
Thank you so much, Dr. Mncube. Thank you so much for a very informative talk. I have asked in our chat group, whilst our small gathering this side is collecting their thoughts, if anyone has any questions or comments, just indicate to me, please, and I will note you. From the chat box on Zoom, there is Dr. Mncube-Gasa, who says, thank you, Dr. Mncube-Gasa, for a very informative lecture. Please explain the relationship between coffee and anxiety disorder. And then there's also a comment from Reverend Zungu. This has been an enlightening session. Thank you. Or it's Masaka. So the question is the relationship between coffee and anxiety disorder. I don't know if there's any questions from the floor, but so that you come up here maybe just the one time, I just wanted to pose this question to you as well. You know, when I was listening to you and I'm thinking about the physical symptoms of depression and how it's much easier for us to accept that I have aches and pains than to consider that my aches and pains could be mental illness. So how do you guys actually deal with the reluctant patients? Because I think on our side as well, there is that difficulty of saying to someone, you know, you're feeling all these things, you're not eating, you're losing weight, you've got aches and pains, headaches, this and that, you're tired. Have you considered that maybe you might be this sort of help? Thanks.
I'll start with your question. I'm laughing because it's what we deal with on a daily basis in terms of my advice would be, firstly, in maybe the manner in which the question is asked. That's what I found in my videos, which I did with some of our clients, is that they always say, but I went to this doctor, I went to this clinic, and they told me, you just have stress. And they throw their hands in the air like that, literally say, you just have stress. And I don't know what that means. So then it goes back down to breaking it down and asking them, how are you feeling? What's happening in your life? Because without even saying what is the stress, or when someone tells you what is happening in their life, they will feel no, I'm okay. It's just that I have to wake up at 3 in the morning and prepare for the kids because then my husband is sleeping, but then he only goes to work at 10 a.m. and he works 5 minutes from my house, but I have to travel for 2 hours. In that statement, I've said a lot. I am stressed, I am overwhelmed, I am feeling unappreciated, and I am overwhelmed. I'm not getting the support.
And to listening.
It's listening. It's listening. They're always there. And yes, it's true. It's easier for any individual to go to a physician, to a general practitioner with the aches and pains, but we do not make that connection that my aches and pains are due to the fact that when I'm stressed, the same neurochemical, we call it that chemical that is responsible for my mood, it also controls my sensory pain threshold. So if this chemical is lowered because I am going through a depressive episode, which means then my pain threshold also gets lowered. So I keep on complaining about certain pain, certain aches, and I will take all the analgesics, but they won't help me because the problem is not only just the physical pain, but all the mechanism right there at the brain, the chemical connected. And back to Dr. Campbell. Coffee and anxiety. Coffee is a caffeinated drink. And what does caffeine do? Caffeine, it helps us to be wired. So basically, also neurobiologically stimulating the glutamate, we're stimulating your cortisol and adrenaline to then send you to a sympathetic nervous, system, so sympathetic drive. You flush, your eyes are open, and all of that. And then what happens is that for an individual who already is living on an above average level of normal anxiety or non-pathological anxiety, that means that person's levels of adrenaline, that person's levels of cortisol are always more higher compared to the average person. So adding things such as caffeine to actually stimulate that sends them on overdrive. I may be somebody who is prone to anxiety attacks, or I may have an anxious personality, but when I take my coffee, then I'm actually sending myself to overdrive, more prone to having anxiety attacks or ultimately an anxiety symptom. And for some people, because even good things can be addictive and there can be problems, there are some of us who are addicted, who are dependent on caffeine to the point that when we are without caffeine, then we have withdrawal symptoms. And part of the withdrawal symptoms, psychological symptoms of withdrawal from caffeine, is that of irritability and anxiety. So that helps to make the switch.
While you're still there, Doc, there's a good question from the chat. I hope they can hear me. Mama Tediso, Mama Bono says anxiety makes one to struggle with sleep. Are sleeping tablets a solution and good for one's health? Worried because they are also addictive, and what about side effects? It's something that I think all doctors struggle with.
Yes, sleep disturbance is also one of the core symptoms or signs and symptoms of anxiety. Because in treating anxiety, we need that pill or those medications called antidepressants, and they usually take a bit of time to start being effective. We do rely on other medications, as I had said, which are called anxiolytic, and part of those anxiolytic, anxio is anxiolytic, means breakdown. Is it Greek or Latin, doctors? Lytic? Greek or Latin, breaking down. So anxiolytic are pills that we use to break down or to halt to alleviate our anxiety. Part of those symptoms, there are some of the medication which are for sleep, or which we would refer to as hypnotics, which help us with sleep. They either help us in initiating sleep or maintaining sleep. It is very, very important to know that for all hypnotics, they are to be used for a certain period of time, not more than 4 weeks. The reason being is that the biggest side effect is that of habit forming for addiction. That's why they're not used for lengthy periods of time. And they start altering other parts of our brain, which then make us feel pain and wanting more of that medication. So anxiety, we do use sleeping tablets, but only for a limited period of time, whilst we awaited the antidepressants to start having an effect. But also through therapy, psychotherapy, our psychologists, they do help us in certain techniques such as breathing exercises, and also with meditation, it helps other individuals in terms of feeling more calmer, maintaining their state of sleepiness and going to sleep. But yes, true, side effects of habit-forming addictions with sleeping tablets.
I will just finish off by reading some of the comments from the Zoom chat box. Cesar Zuma says, thank you, Doctor, much appreciated. Rev Nyamitati says, thank you so much for this informative presentation, Doctor. This is a challenge to us as a church. Church always appears in these helpful institutions that are listed. Yes, important. Indeed, I'm not doing enough as a clergy. Lord have mercy, I repent. Mate Matati with us here also says, thank you so much, Doctor, for such powerful presentation, much appreciated. And Mshongo O says, thank you, Doc, for this very important presentation. As a church, we need to get this information out to denominations and branches. The stats shared is calling for a more focus on males who are so often neglected in course. So thank you so much, Dr. Mncube-Gasa. Really, I also just want to highlight this surprising stats that you shared with us, that 1 in 8 people have a mental condition, possibly now higher, with us being post-pandemic, and that depression is one of the leading causes of disability. And truly, that is something that not all doctors are thinking about. We're not so open-minded to mental illness. And we focus on the diabetes, the hypertension, lots of medications that we are prescribing to our patients and not thinking about those psychological impacts as well. And then suicide is the third leading cause of death in the young, and surprisingly from as young as 10 years. So really something that we need to open our minds to, more discussions in our church programs. These are things that we need to focus on. And we also draw our attention to the fact that males, they do not seek help, they withdraw, but then if they attempt suicide, they are successful. Yes. So really, I think as the church community, sometimes we take that withdrawal as a cheekiness or a misbehavior, and we do not respond with that inquiring spirit. How are you? How are you doing? What's happening in your life? You know. So really, there's a lot that we can take from the talk. Thank you for all your examples, really. And there is a request in the chat box if you would make your presentation available for us to share. Thank you very much. So, quickly rounding up, we're going to ask our Presbytery Elder Sean Swansby. You can just come forward for a vote of thanks. And then I will not return, I'll ask Reverend Cecil to just come up after that for our closing remarks and prayer.
Thank you, Nancy. I think you did a very good job of thanking Dr. Gasa for me and the participants as well. What I took from it was that everything is treatable, and that was what I wanted. Just as a sign of appreciation, I'd like to present you with this gift.
So just in the closing remarks, we just want to say thank you on behalf of the church. It's been really honored to have you in our presence, and thank you for making the time. I think that's important. Your time is so precious to you, and we really appreciate that. It's also important to understand that there's a need for social awareness and social help in the church itself. And as I was talking to you earlier on, I said when we get sick, we will go to the doctor with a stomach or whatever it is, and quickly get some treatment. But we just disregard the mental health part of it. And so thank you for highlighting that. And we on the ground as ministers, that we see it every day. And so thank you for such an informative lecture, that we become more aware of what's going on, and we can treat, and then we can also refer. So we thank you for that. Because I think part of the treatment is bio, psycho, social, and spiritual. So Jesus said, come to me all who are weak and heavy, and I will give you rest. And so we thank you today. May God richly bless you and your family in all that you do. As you continue to respond to what you do. Thank you. And we pray together and close. Let's pray. Dear God, we are grateful for your goodness and your mercy, and we thank you that we had this wonderful talk with this lecture. We thank you for your dear servant that has spoken today and has shared her thoughts with us. We ask you that you continue to guide her. We also pray for our church, the Ethekwini, Presbytery, and the UPCSA, and all the branches and all the departments. We ask you that you help us as we take this on, this mental healing and awareness. We ask you that you guide, this strength, and your Holy Spirit comfort, and give care and comfort as we minister to others and congregations are more aware of it, and we help one another in becoming better people in the kingdom of God. This we ask in Jesus' name with thanksgiving and praise. And now may the grace of our Lord Jesus Christ, the love of God the Father, and the fellowship of the Holy Spirit rest and abide with each and every one of us this day and forever. Amen.
Amen. Thank you so much, everybody. Just a final word, if you'd like the presentation, please just type out your email address in the chat box, or else send me an email to the address I have shared, and I'll share the presentation with you. Good night, everybody. Thank you for joining us.